Did you know that in 2023, the US healthcare industry was valued at $4.9 trillion? That's with a T, not a B, not an M, trillion. I'm American, but I live in Spain now. And let me just say this, if you've never lived outside of the US, you might have no idea how broken our health insurance system actually is. So, of course, you might be wondering, how does health insurance even work in the USA? And in this video, I'm going to be breaking it all down with real examples, real numbers, and zero BS. So if you're American, pay attention because this could save you thousands. And if you're not American, prepare to be shocked. So let's start off with the most important question when it comes to health insurance in the US, and that is, how do you even get health insurance there? So in the US, you have two options to get healthcare. You have one, private insurance, or you have two, a government sponsored plan. And let me break these down. First, with private health insurance, you can break this down in two separate ways. You can have your employer help you pay for this. So you would have to get a job, and then your employer would basically charge you a monthly premium for this coverage. Next, if you are self-employed, you can buy a health insurance policy directly through a insurance company, or you can go on Healthcare Marketplace, which is basically a website where you would shop and buy your health insurance. And then you have the government sponsored plans. And this can be broken down into two separate things because you have Medicare and you have Medicaid. So Medicaid is usually for low income families or for people with disabilities. And then Medicare is for senior and older citizens. For the sake of this video, I'm going to be mostly referencing private health insurance. All right, so the first thing that you need to know on how does health insurance work in the USA is that if you have private health insurance, you're going to have to pay a monthly premium. And you could think of this as a subscription fee because you basically have to pay for this to have coverage, whether you use your health insurance or not. All right, so now let's try to go with some real life examples so we could try to visualize this stuff. So we are going to have Alex. Alex is a young professional who works at a marketing agency, and she was able to get private health insurance through her employer. So every month, Alex gets billed $350 monthly for her health insurance premium, and she has to pay this regardless if she goes to the doctor or not, because this is what she has to pay to have coverage. So you might be wondering, how does your monthly premium get billed? So this usually gets taken out of your paycheck with your employer. So when you get hired at a job, usually if they provide health insurance, they'll sit you down with HR and they'll explain the benefits, they'll explain the type of options that you have, and then you'll choose one and then you'll get billed that, and that lump sum amount will get taken out of your salary each month for your health insurance. So the next thing you need to know on how health insurance works in the US is all about deductibles. Deductibles are the amount you have to pay out of pocket before your health insurance starts to help cover costs. So now let's go to a real life example with the deductible. Alex gets bronchitis. She's very sick and she unfortunately has to go to the emergency room. She goes to the emergency room and her medical bill is $2,000. Alex's yearly deductible is $1,500. So how does this deductible get billed in this situation? So Alex pays the first $1,500 out of pocket, and the health insurance covers the remaining $500 left on the $2,000 medical bill. Until you've hit your deductible, it's basically like you're uninsured. So keep that in mind because if you have a very high deductible, it might be hard to actually meet that within a year. Now, the next thing you need to know on how health insurance works in the US is all about copays. Copays are a fixed fee you pay for a specific service like seeing a certain doctor or filling a prescription. So let's go back to our real life example. Alex has gone to her primary care physician after she got bronchitis for a regular checkup. Alex's copay is $30 per visit. So Alex pays $30 at the front desk receptionist when she goes to see the doctor, and the insurance will cover the rest. You can think of copays as another ticket fee to access care, even if you're covered. The next thing you need to know on how health insurance works in the US is all about coinsurance. Coinsurance is a percentage you pay for care after your deductible is met. So let's go back to our real life example. Alex has already paid her $1,500 yearly deductible, but a month later, she needs minor surgery on her knee. This surgery costs $5,000. And here's how Alex's health insurance plan works with coinsurance. Alex's health insurance plan has a 20% coinsurance that's her responsibility, and the healthcare insurance company will cover 80%. So Alex will have to pay 20% of this $5,000 surgery, which equals out to $1,000. The insurance will cover the remaining $4,000 for her to get surgery. It's super important to know that even if you've met your deductible, you will still have coinsurance until you've met your out of pocket max within your health insurance policy. So now I know you're definitely wondering what the heck is an out of pocket maximum? So, an out of pocket maximum basically means that this is the most money you'll pay to your health insurance policy in 1 year, excluding your premium. After you have reached your out of pocket maximum, your health insurance will then cover you at 100% of the covered costs that are in your contract. So now let's go back to our real life example of Alex. Alex's out of pocket max is $6,500. But remember, Alex has already met her deductible of 1,500 when she got bronchitis and she had to go to the ER. Then she got surgery and she had to pay another $1,000 for her coinsurance. So far, Alex has spent $2,500 towards her out of pocket maximum. So for Alex to be covered 100% for the year, Alex needs to go ahead and get more medical procedures done. Specifically, she would need $4,000 more worth of medical procedures to total out her out of pocket maximum, which is 6,500. And once she meets that, she would then be covered at 100% for the rest of the year. So you can think of your out of pocket like a financial safety net, but it's obviously still a lot of money. Now, let's say you've met your out of pocket maximum for the year. It's important to know that your health insurance is now going to cover you at 100% for certain covered services. So, this is when in network and out of network really matter. So you might be wondering what's the difference between in-network and out-of-network. So you could basically think of in-network as discounted partners and out-of-network as full-price strangers. And I'll explain this a bit further. You could basically think of in-network providers as medical providers that do accept your private healthcare insurance and also have contracted rates with their services. On the contrary, out of network medical providers do accept your health insurance, but do not have contracted rates with their services. So they could basically charge whatever they want when they go to bill your insurance. So most people in the US usually stay in network when it comes to their private healthcare, but if you do have really good healthcare, you might have access to really good out of network benefits. People who have really good private healthcare insurance in the US are people who usually work for the state, maybe they're social workers, teachers, cops, etc. All right, so let's go back to our real life example about Alex. Alex has sprained her ankle and she needs to find an in network physical therapist. So the physical therapy visit is $150 total. And remember, Alex will be responsible for 20% coinsurance, which will be $30 that she will be billed after the physical therapy visit. The day of the physical therapist appointment, Alex will then pay her $30 copay. Alex doesn't really have the best health insurance policy out there, so she also cannot go out of network for extra providers. And since healthcare and finances are so intertwined in the US, there are crimes that are committed around this topic, such as health insurance fraud. And these are things like overbilling if you're a medical provider, or overcharging for services, or possibly billing for things that you didn't even provide. Health insurance fraud, unfortunately, is something that is quite common in the out of network medical world in the US because not a lot of people control that. So a doctor can bill like crazy, and there is a good chance that nobody's going to check that, and that doctor can go make a whole lot of money. And a lot of the way that the out of network providers work in the US is that for some reason, the health insurance will send these checks to the patient, and then the patient has to be trustworthy enough to basically give it to the doctor. Sometimes the patient doesn't, though. And this is when the patient gets in trouble, and they could also be charged for health insurance fraud because they basically went and did a procedure and they owe that doctor money, but they never paid with that health insurance check. Some other examples of health insurance fraud are basically if you apply for Medicaid and you say that you're not working, maybe you say that you're unemployed and you're in the low income level, and maybe you are actually working, but you're just working off the books, but you're not reporting. That's illegal in both ways because you're not just committing health insurance fraud, but you're also not reporting your taxes. So that's really bad. I would definitely not recommend to do that. But unfortunately, these are things that people do because in the US, some people feel like they got to do what they got to do to survive. And that's just how the situation is. So as you can see in this video, the healthcare system in the US is absolutely horrendous, and it is so set up for most people to fail. And I'm not talking about just medically, I'm talking about financially too. And now the last few things that I want to talk about are FAQs on health insurance in the US and the No Surprises Act. So I'll start with the No Surprises Act first. The No Surprises Act was a law that passed in the US in 2022, and the purpose of this was to prevent surprise medical bills. I think this is great because there are a lot of medical emergencies that people have in the US, and that is where you can get a lot of medical bills. So let's say, God forbid, you get into a car accident and you have to go to the emergency room and you get rushed to the ER in an ambulance. that might not be covered by your insurance, and that could be very expensive. And these type of situations are what can put people into financial ruin. So the No Surprises Act was really good. Hopefully nobody takes it away and it stays in the US forever. All right, and lastly, let's get into FAQs. And the first FAQ is, until what age are you covered under your parents' health insurance? So you're allowed to stay on your parents' health insurance until you're 26 years old. And that is thanks to the Affordable Care Act, ACA. Hopefully they never take that away too. The next question is, what do people do if they have to quit their job and they need their health insurance? So, God forbid you can't work and you become disabled, you would then be eligible for Medicaid, people with disabilities or people with low income. Another solution for this situation is to go on COBRA. COBRA is temporary extension of your job insurance. So the health insurance that you got with your job, you would basically be able to carry that on for a temporary time. The time period of COBRA is usually from 18 months to 36 months. The downfall of COBRA is that it's very expensive and a lot of people can't afford that premium once their employer isn't helping them with their healthcare coverage. Another solution for the situation could be disability insurance and then Medicare. So if you are disabled in the US, you can qualify for SSDI. SSDI is Social Security Disability Insurance. And then after 2 years on SSDI, you usually can apply for Medicare. And the next FAQ is all about if you're self-employed. And this is, how much would a health insurance policy cost in the US if you are self-employed? When I've bought a health insurance policy, it was 4,000 US dollars. And the way that worked is I got 4 office visits a year. So that was it. I was capped at 4 office visits. So it wasn't unlimited visits. And on top of that, I was able to go to 2 specialists within these 4 visits. I had a copay of $50 as well. And I was not responsible for anything. They covered me at 100%. I remember I went to get a physical and then I went to go get blood work and they did not cover me for blood work. If I wanted to do the blood work, it was going to run me about $1,000. And I said a hard pass. I did not pay for that. So you can get an idea on how much health insurance costs in the US if you're self-employed. It's super duper duper expensive. And this is why a lot of people don't even go self-employed. They rather just stay with an employer and have all these great and secure benefits because it'll run you a lot cheaper. And the last but certainly not least question is all about, why does health insurance in the US even cost so much? Because it's private, it's profit driven, and it's full of middlemen. Hopefully we'll see a day where healthcare in the USA is free for everybody. Hopefully. I don't see that day coming anytime soon though. Outside of that, thank you so much for watching. I hope you enjoyed learning how healthcare works in the US. I'm pretty sure most of you are shocked if you're not from the US and this is the first time you're hearing this. As you can see, it is a pretty bad situation and it is